Tuatahi rā, kei ngā mātā waka e hui mai nei I tēnei rā, nau mai, haere mai ki tā tātou kaupapa whakahirahira. Ka nui te mihi mahana kia tātou katoa. Welcome to He Kawa Whakaruru Hau Cultural Safety Policy webinar. Thank you for joining us. However, before we get started, let's open our kaupapa up with a karakia. E o mai te ti, e o mai te tā, he rea ki runga, he rea ki raro. Whiria kia mau, whiria kia ita. Hua kene te pō, nau mai te ao. Ka ao, ka ao. Ka ao atia. Tihei, Mauri ora. Mauri ora e te whānau. Ko Kylie Hinirangi ahau I ria ngō Ngāti Mania poto, he mihi mahana kia tātou katoa. Today we are joined by Dr. Peter Jensen and our portfolio managers Greg Swan and Miriam Graham. So just big nau mai, hara mai to Peter and to my colleagues Greg and Miriam, tēnā kōrua. Miriam is here to assist with our Q&A session at the end of our kōrero. So I ask that you please submit any pātai you may have via the chat function, and please direct these to the question monitor. Questions sent to our other co-hosts and presenters, we won't be able to see them, unfortunately. So I'll kick us off with a bit of a kōrero around our policy. As we all know, we are in the midst of the health sector reforms under the Pai Ora legislation and with the formation of Te Ako Whai Ora and Te Whatu Ora. He Kawa Whakaruru Hau moves to reinforce, resource and support some of the enhances happening within the sector. This goes to support some continuity within the sector as a fellow kaitiaki of the health alongside the Ministry of Health, Te Ako Whai Ora and Te Whatu Ora. Within He Kawa Whakaruru Hau, you will find reference to the Hauora report by way of the Te Tiriti principles and their application. Whakamaua Māori Health Action Plan developed by the Ministry of Health to drive Māori health equity across the health sector. And in February this year, you would have seen the release of the Cultural Safety Education Framework by Te Ohurata and the Council of Medical Colleges of New Zealand that shows the alignment of expectations between the medical colleges and He Kawa Whakaruru Hau. Our approach to date has been designed in consultation with professional bodies, New Zealand Nurses Council, feedback within our providers and suppliers, engagements, ACC's whānau oranga pūmauropu, bringing our kiritaki Māori voice, as well as our own kaimahi within ACC. This approach has helped us to bring the Crown, sector, provider and whānau Māori views together to help form this policy. A little bit of whakapapa. Back in Te Matatini in 2019 in Wellington, we asked whānau that attended the event for their views on ACC. And those views made way for changes within ACC, including developing services like rongoā, kaupapa Māori health solutions, and cultural safety mahi like this, just to name a few. This year, we went back to Te Matatini at Ngā Anawai at Eden Park in Tāmaki Makaurau to report back on what we've been doing with that kōrero that was gifted to us in Wellington. And again, we asked whānau for feedback about mahi like cultural safety. And as you can see from this slide and the next, whānau are validating that this is where we need to support a little bit more. As you can see, feeling safe to be Māori was a dominant theme when we asked what culturally safe services or care for Māori look like. Why a Māori worldview of cultural safety is important? So that's one of the pātai we've been asked. We've committed to improving customer access, experience and outcomes for kiritaki and whānau. And in our cultural safety project team, we have approached this mahi with the respectful braiding of Te Ao Māori and Western worldviews. Using this approach, we have created the cultural safety policy, ensuring that we as ACC demonstrates that we are true Te Tiriti partners and that we bring to life our Māori strategy via Te Tika and enable its strategic intent. We know we are not operating in isolation. The health sector is leading this already, and we are reinforcing that, ensuring our partners are supported to uphold cultural safety. Our literature has informed us that while the focus is on Māori, all other cultures will benefit, including a Māori approach and a Māori worldview to cultural safety is going to help ensure that it is for the benefit of all people living within Aotearoa. Furthermore, the policy aims to support a meaningful and sustainable advancement towards cultural safety in our health services. It's about learning and also unlearning, being aware of our biases, our attitudes that may impact on people, and understanding the preferences of people not from our cultural, religious, or ethnic background, and engaging with communities and learning their unique needs, providing an improved service that meet the needs of all whānau. The document you can see on screen, while the policy is the how, the what, sorry, this guiding document, Te Whānau Māori Me o Mahi, is a resource to support the how. The policy should be read in conjunction with the guidance, which was developed by Dr. Peter Jansen and his Moriora associates. And both documents can be found on our ACC website at acc.co.nz/cultural safety, along with other support resources and training links. And speaking of Matua Peter, let me hand now to him to share more about our competency guidance and its links to the policy. Over to you, Matua Peter.
Kia ora Kylie. Ka nui te mihi mahana kia tātou katoa. Ko Peter Jansen taku ingo, he uri ahau no Ngāti Hirirangi me Ngāti Raukawa. Let's begin with some background. Since reliable data on Māori health and other issues with regard to ethnic groups became available in the 1990s, it's been clear Māori have higher health burden but receive less care and less support across the health sector, including ACC. So there's a lower standard of care that's also delivered to Māori, including less intensity and less access. That varies by different parts of the health sector. At the same time, there was a move towards establishing the Health and Disability Commission. That, of course, was a response to the National Women's issue of unconsented research and other poor practices. The Code of Rights for Consumers of Health and Disability Services was promulgated in 1996, and the first right is to take account of the needs, values, and beliefs of the patient, whether that's cultural, religious, social, or ethnic. Next slide, thanks. In 2003, the Health Practitioners Competence Assurance Act came into being. That was an act that consolidated different acts governing doctors, nurses, physiotherapists, and others. The goal of that act was to provide a consistent accountability regime for all health professions. A range of responsible authorities were established, including nursing, physiotherapy, dental, dietetics, medical, and many more. In that act, there was a new concept of cultural competence. That's section 118 about the functions of the authorities. That section says all responsible authorities need to set standards of clinical competence, cultural competence, and ethical conduct to be observed by the health practitioners. A later amendment in 2019 came about after consultation, review, feedback, consultation with practitioners and the public and the responsible authorities. That amendment clarifies that cultural competence includes competencies that will enable effective and respectful interaction with Māori. Next slide, thanks. So here's a list of responsible authorities, quite an extensive list. There's 18, and all of these are required to have those standards in place. There's a range of other groups that are being considered for responsible authority status, including clinical physiology, cardiac perfusion, physician associates, Western medical herbalists. There's also a number of other groups that provide care to people in New Zealand that have their own legislation. One example is social workers. And you'll see within those groups similar approaches to cultural competence and cultural safety, because many of these groups will also have to meet the Health and Disability Commission Code. In fact, if a provider or an organisation is providing healthcare services to patients, whether that's via these regulated health professions or on contracts or otherwise, they need to meet the HDC code requirements. So this guidance from ACC will assist everyone who's looking after kiritaki and whānau. Next slide, thanks. ACC has been monitoring Māori access and other things over time, and ACC has confirmed that there's less access, less intense support for Māori within ACC funded services, some areas more than others. So in keeping with the HPCA Act, ACC introduced competencies for providers in the early 2000s, so they were known as hauora competencies. ACC also supported providers at that time by commissioning the initial guidelines for Māori cultural competence and delivering training sessions. Māori Order Associates was part of that back in the day when those guidelines were first published in 2005. And we were privileged to be able to support ACC in updating the guidance in 2022. There was a similar process for both things, looking at literature, many rounds of debate with expert reference group that included kaumātua and review by sector experts. Responsible authorities and related groups such as medical colleges, for physio, nursing, dietetics, medical, have provided training in cultural competence over time, and many of you have had the opportunity to go to that. Sometimes the training is in person, it might be online seminars, readings, guest speakers, some included marae visits. All of these offerings to health workers were so that people could learn something of the history of Aotearoa, the very sobering data on health inequalities, and something about Māori preferences or the differences between Māori views and experiences and non-Māori. However, over the 20 years since this has been in play with the HPCA Act, and more than 25 years since it's been a requirement to treat everyone with respect under the Code of Rights, we haven't seen a significant change to the persistent unequal disparities in access to care and outcomes for Māori. So we're now, the whole health sector is looking at what comes next. And that's a move towards cultural safety, something that most health professionals are aware of and see it as something that's coming from their professional bodies, their responsible authorities. Most of you will be aware that cultural safety is a concept that came from the work of Eddie Hapiti Ramsden, and it quickly gained momentum within nursing in Aotearoa. Just a reminder, the goal here is to ensure that services are delivered equitably to clients and communities in a way that respects the values and beliefs of the client and the community. Key concept is that the kiritaki and the practitioners are working in equal partnership, having regard to the health of the person and their community. Providers need to recognise, respect, nurture the unique cultural identity of all patients, especially where they come from cultures or backgrounds dissimilar to your own. So to do that, to respect people, we need to critically examine ourselves and the impact that we might have because of our biases, our background culture, our assumptions, how that does affect our interactions. As noted on the previous slide, a key part of cultural safety is reflecting and addressing our own biases and stereotypes, both historical and current. We've all got biases, so it's about uncovering those and considering, are they playing a part in our interaction? When I say we've all got biases, I have them. One bias I have, because of my culture and background, is that I can be a little misogynistic. So I invite my critical friends to pull me up if I start to drift that way. We also all have access to data sets on who's trying to access our services, who gets seen, when they get seen, on outputs like the treatment that was provided, the prescriptions that were written, changes to the health status of patients. We need to review those data to monitor the inequities that might occur, inequities that could be with regard to patients. They can also be within our own workforce and the representation of various groups in our workforces. We need to use all of that to reflect and then make a plan to reduce any inequities that we find so that we reach the goal of health equity by having a plan, measuring the outcomes, and then further monitoring and revising our plans. Organisations will need to keep evidence of how they do that, and they'll need to think about evidence of whānau engagement in the planning and the review processes. Cultural safety training will be a part of your plan alongside performance monitoring. We need to also think about what impact that training has across the whole practice, the environment, the policies, the consultations, and more. ACC has been on a journey, just like the health system, just like provider organisations and individual practitioners have been on a journey towards health equity for Māori. ACC has spent a lot of time on an organisation-wide competency and responsiveness program called Whāia Tika. Has also developed Māori-focused injury prevention programs, and in the process of developing Māori-specific treatment programs that have been built on the success of pilots to date. Allied to this is, of course, kawa whakaruruhau that Kylie spoke about, and this will apply to all suppliers, whether contracted or regulated. You can see for the list on screen about those requirements. They match the guidance that's been published by your responsible authority and other organisations. And again, this list encompasses planning, reflection, monitoring, and training for all team members. On the screen there, you see a picture of the document that Kylie spoke about. It's available from the ACC website. I want to highlight three things in this document. Firstly, we've updated it, of course, but we've introduced a series of questions in the guidance to assist the reader with reflecting on the impact of the providers and their organisations. These occur from page 15 onwards. The questions may help you reflect on issues such as staffing and whether your staffing reflects the population you serve. Reflect on how you collect information from patients, how you do that in a practical way, and consider your own assumptions. Secondly, there's a large section on communications because that's a really key issue. Lastly, I want to highlight that we retain some of the vignettes from the original document that were given to us by Māori patients and colleagues. But alongside those vignettes, we've added some reflections to assist you in thinking about what the training and monitoring needs might be. The document is on the website along with links to helpful sources of information and training. Thank you, everybody. Back to you, Kylie.
Oh, ngā mihi. Now I'd just like to hand the time over to my amazing colleague, Greg Swan from ACC to share some of his insights into applying the policy. Kia ora, Greg.
Kia ora, Kylie, and thanks for the introduction, and good afternoon, everybody on the call this afternoon. So as Kylie says, I'm Greg Swan. I'm a portfolio manager here at ACC. In this role, I manage the allied health services. And I've also been involved in standing up our new Kaupapa Māori solutions and as part of this cultural safety mahi I got involved as I recognised that we need to make changes here at ACC to better support Māori, as Peter's already indicated. So the current inequity in terms of services and resources and access were something that just struck me as really not being fair. So that was my kind of motivation. So in terms of the policy, how does it fit within ACC's contractual framework? So for contracted suppliers, the policy has been issued under the Health Contracts Standard Terms and Conditions, and will apply to all contracted health and rehabilitation suppliers. And as mentioned, it's designed to complement your existing regulatory and competency requirements. For our non-contracted and regulated suppliers operating under the cost of treatment regulations, it's an expectation in line with our Working Together handbook and position statements. Initially, our focus will be on raising awareness of the policy and helping you, our suppliers, to understand the requirements. It's important to think of this as a journey and one which will evolve and change over time. So as our expectations, those of our kirataki, and also those of you, our suppliers, change and mature, the policy can be updated more easily than changes to contractual terms and conditions. So we expect that the policy will be refreshed regularly to keep it in line with sector approaches. So as Peter mentioned earlier, there's some expectations of you as providers and suppliers. So our key expectations are that cultural safety is embedded into the services you provide. And that includes support functions such as reception, not just clinical staff. We expect you to have processes put in place to ensure continuous improvement, progressively seek to understand and work to address cultural differences and biases. And not just for Māori, but for groups from all different cultures and backgrounds. And progressively improve access to your services to achieve equitable outcomes. One of the questions we've been asked regularly since we started our work on the policy is whether suppliers will get paid more for delivering cultural safety. While we acknowledge the increased workforce pressures and other challenges you face, it's our expectation that all our providers and suppliers should already be delivering health services in a culturally competent manner. And as Kylie mentioned earlier, the policy was designed in consultation with the health sector, including your regulatory bodies, to ensure it aligns with widely accepted approaches to cultural safety. So as these approaches should already be in place in your practice, no additional funding will be provided. Through the policy, we're providing clear expectations and also updated support through our guidance and suggested resources for those who feel they may need to lift cultural safety in their practices. Meeting the requirements of the policy will assist you in achieving goals relating to Māori health equity and your professional standards for cultural competency and culturally safe practice. You'll find lots of additional information, including helpful support material and frequently asked questions on our website. So what are the things you need to be aware of? Peter and Kylie have already mentioned many of these already, but just to recap. Ensure you've got a good understanding of the cultural competency guidance provided in our Te Whānau document and put these into action. As Kylie talked about, this document forms the how. Meet or exceed any professional requirements related to cultural safety, which can be done by incorporating self-reflection, self-awareness, and peer review with a focus on those power relationships and bias. Involve kiritaki and their whānau in your services so you truly understand any barriers which exist and can work to remove them. And finally, as Peter talked about, maintain records to demonstrate how you've applied the policy. Application will look different for different providers, so there's no standard template for what the records need to look like. But self-assessment and peer review will be a good place to start. So what are some of the issues to consider in terms of your workplace and workforce? The first one is that we want you to apply the policy consistently across your organization. That means at all of your sites and for all of your staff. As I mentioned earlier, including support staff. They have a key role to play in ensuring that all kiritaki receive a level of service which is culturally safe from beginning to end. We want to ensure that cultural safety is embedded across key business processes, including service delivery, but also including processes such as recruitment. So that employment opportunities reflect the diversity of our ACC kiritaki and also support functions such as reception and back office staff. As we said earlier, ensure that regular and mandatory cultural safety training is provided and that all staff are included in it and have access to it. Community engagement and building relationships, including engaging and working with local iwi and other underserved cultural and community groups. Engagement is built on trust, authenticity, reciprocity, and a willingness to share and learn from each other. And also remember, building effective relationships actually takes quite a lot of time. Over the coming weeks, we'll be sharing some examples on our website of some of the great things our suppliers are already doing to demonstrate their commitment and approach to cultural safety. Look out for an awesome case study, which is about to be released, and we're keen to see more examples. Okay, thanks for your time, everybody. Back to you, Kylie.
Kia ora, thank you, Greg. Ngā mihi. So we know much work is happening in the sector to improve cultural safety in your services already. And I'd like to hand back to Matua Peter for some final words around our calls to action.
Kia ora, Kylie, thank you. So here's some words on the page. If you're a practitioner, let's start having conversations. Talk to your colleagues about cultural safety. What does it mean to them? Do they have experience in this? Look at your professional body's publications and think about their expectations around cultural safety and then some opportunities that they might be presenting to go to some learning events. Start thinking about cultural awareness, capability bias. Reflect on your own skills, your own knowledge. Talk to your colleagues about that. Do read and understand kawa whakaruruhau, the guidance. Maybe you take that to your peer groups and discuss what's in there and what it might mean for you. I think if you start talking about it with your colleagues, it will be less frightening, less difficult, because we're all in this together with the goal of improving care for Māori. Back to you, Kylie.
Kia ora. Thank you, Dr. Peter. And we'll go over to Greg if you've got some kōrero for us around calls to action as business owners.
Thanks, Kylie. So what are some of our asks of you as a business owner after this webinar today? What can you do to help our clients and your practice on the cultural safety journey? Some ideas here. To talk to your team about what cultural safety means to them and come up with a plan. Review and if needed, refresh your internal policies and procedures with a really critical lens, looking for some of that unintentional bias that Peter spoke about, and seek to remove some of the barriers. Undertake cultural safety training with your team. including non-clinical staff, and start thinking about how to improve or build some community linkages to help connect you better with the people you serve. As I said at the outset, remember this is a journey. You don't have to do everything at once. And once again, we've got further support resources, including FAQs on our website to help you. Back to you, Kylie.
Kia ora, Greg. So as you can imagine, if we're putting out this policy, we also need to be talking about the action that we're taking within ACC. So in line with what we are asking providers and suppliers to do, we at ACC are also improving our own cultural capabilities. Te Kāpihu Whetū is the Māori Outcomes Framework that will measure whether we are achieving our goal of oranga whānau or whānau wellbeing for Māori. It'll be one of the ways that we deliver on our Te Tiriti commitments. We will monitor these measures of organisational success as defined by Kiritaki, our clients, and whānau Māori. We're also developing a Māori cultural safety approach for our own ACC kaimahi to adhere to. This will align with this policy and what we're asking of you as providers and partners. This work is being managed by our project team, along with Paiora, our Māori and Equity team, and our People and Culture team. And our cultural capability lift across the organisation, as you can imagine, is ongoing. With those call to action, this whakatauki, I believe, embodies that. It brings these calls to action into perspective. Cultural safety, like equity, is all of our business. We all have an important role to play, and we can all have positive interactions with our kiritaki and their whānau. So yeah, thank you to everyone who has posted some pātai in our chat, some questions in the chat function. I'd like to ask my colleague Marian to facilitate this last wahanga or section of today's webinar. Tēnā koe, Marian, do you have any pātai for us?
Kia ora and good evening, everyone. Yes, we do have a couple of questions in the chat. So I'm going to pass this one over to Peter, if I may. So why should suppliers and providers apply this new policy?
Good question. The why is pretty simple. It's about fairness. And we talked at the beginning about how there's overwhelming data to show that Māori have received less access to care, less intense treatments in some parts, and worse outcomes compared to non-Māori. That's not fair. That's inequitable, and we need to address that. And that goes to the heart of you as a New Zealander. It's part of your DNA, if you like. We all believe in fairness, so let's move on that. I'd also remind us that there's a really important date coming up in a few years. It is the bicentennial of the Treaty of Waitangi. And we wouldn't want to reach that date having not achieved health equity for Māori. That's why the Waitangi Tribunal held hearings into health and continues to hold more hearings about health and access to health and disability services so that we can make more changes and we can, as a whole nation, move towards health equity.
Beautiful, thank you, Peter. There's a couple of questions that are coming in just regarding that, what we're asking could take additional time. And so people have been asking, will ACC pay providers extra time or extra money to upskill in cultural safety? And I'll hand that one over to Kylie.
Kia ora, thank you, Marian, and kia ora for that pātai. As mentioned earlier, there will not be any additional funding for this. We've already set out that the expectations set out by ACC within the policy are directly in line with your professional bodies and regulatory body expectations in terms of cultural safety and cultural competency. So in short, no, there will be no extra funding for you to meet those obligations.
Thanks, Kylie. Peter here. I'm just going to add some more to that. Some really good studies done in North America looking at health practitioners and their consultations showed that we frontline health professionals are trained to get to the answer and get to it quickly. So unfortunately, that can often mean that we interrupted the patient. The same studies went further and trained primary care practitioners to not interrupt the patient, and the patient talked for another average 17 seconds. So more time, a tiny bit of extra time, but the outcome of that was a much more satisfied patient, greater experience, and less concern by the practitioner that they had missed something. So maybe a little more time, but a much better result.
Kia ora. Thank you, Kylie and Peter. We have another question that's come through. Will ACC audit providers to help them to be held accountable? And I'll pass it over to Kylie again, please.
Yeah, kia ora. Not in the first year. So this first year, ACC, our teams will be going out to raise awareness about the policy. What we've also done is we have formed an external expert reference group for cultural safety. This expert group will support us to understand what does good monitoring look like, to make sure that we stay within the realms of fair expectations, but also so at an operational level, what does that auditing look like, or that monitoring look like, and what does measuring look like? So in the first year, no, but after that, we will look to audit and monitor what good looks like in terms of cultural safety.
Kia ora, thank you, Kylie. I have actually got a question that's been directed straight to me, and I'll just, so it's a quick and easy one for you, Peter. What was the name of the online tool you can use to identify your own cultural biases?
Yeah, implicit association test hosted by Harvard. You can also find links to that from the Ministry of Health website and various other New Zealand websites. It would be nice to have a New Zealand developed one. This is the international standard, and no, we don't have a New Zealand one. But it tests different biases that we have. So implicit association.
Kia ora, thanks, Peter. I think we'll all probably be jumping on and testing ourselves.
I think somebody's just posted it in the chat.
Wonderful. Okay, thanks everyone. So Kylie, I've got another one for you. So what about cultural safety within ACC?
Yeah, good question. So yeah, we are developing our own cultural safety approach for Kaimahi as part of a separate project to the cultural safety project for policy for providers and suppliers. Yeah.
Cool, thank you, Kylie. I'll hand the next one over to Peter. So does ACC's policy and cultural competency guidance align with the professional body's advice on cultural competency? And how is ACC expecting us to meet and exceed any professional body requirements relating to cultural safety?
Fantastic. Yes, there is close alignment. Over time, many professional bodies have been working on cultural competence, and they come together following the same kinds of ideas. And with cultural safety, it has a grounding in Eri Hapiti Ramsden's work, and you'll see a lot of activity in that. And again, it all aligns professional associations. So meeting or exceeding ACC requirements should be sufficient to meet or exceed your professional body's requirements. I'm like you, I don't want to do everything 10 times. I have 2 medical colleges that I need to meet their requirements for ongoing training, professional development, cultural competency. So I'd like to be able to do it once, do it right, and tell the colleges I'm doing it and demonstrate the evidence for that.
Kia ora, thank you, Peter. I have another one for you, Peter. Is there anywhere we can source how to get buy-in into treatment sessions? What do we want to improve?
So that's patients who may be reluctant to turn up. Fantastic question. That's really going to the heart of what we need to achieve. So let's follow the guidance about looking at our data, about talking to communities, about surveying our patients, about being open to the answers. I'll give you an example of this. Go back in time, if you're old enough like you'll remember when there were no mobile phones. Whoops. I remember Counties Manukau, DHB, or before it was a DHB, asking that question, why do some people not turn up for their specialist appointments? And we'll just send out more letters. Fortunately, along came the mobile phones and you could text patients. So that required setting up a different system and getting people's mobile numbers and texting them. Now, you might think that's not a good idea for the South Auckland community. Maybe they don't have access to mobile phones or can't afford the plan. Turns out that wasn't the case. That the highly mobile populations of South Auckland were more likely to have a mobile phone and responded really well. And then a whole program around that using technology was really good for populations that weren't engaged, and it's made a humongous difference. So that was about people asking the same question, looking at potential solutions, working with colleagues, working with the community to find the right solution and settling on the right solution, then continuing to improve it over time. So keep asking the question, keep going back to the data and seeing if you're having an effect.
Awesome, thank you, Peter. I think that's we've pretty much answered the questions that I've seen come through. I'll just hand it back over to Kylie and the rest of our guest speakers if they have anything else to close up. But thank you, everyone.
Oh, kia ora, Miriam. Thank you, whānau, for all your pātai that came through. If there are more pātai that you have, please feel free to send them through. Otherwise, you can find our contact information on the website or through your current portfolio manager or whoever you hold the relationship with inside ACC, please send them through. But this is a journey, as Peter has stated earlier today, this is a journey we're all on, ACC, our suppliers and our whānau that are accessing your services. So thank you very much for tuning in tonight and offering up pātai. We will gather up the pātai that have already been asked, as well as any pātai that come in afterwards, and we'll make sure that we update our frequently asked questions file on our website, and these will also be sent to you as participants of the webinar within the next week, along with the key website links that you see on the screen right now. But the webinar will be available on the website, as will the slides for you to recap, and the transcript will be on the website as well. So any of the technical glitches that you might not have been able to hear quite clearly this evening, we will make sure that you have a copy of that transcript so that you can make sure to get the full kōrero that came through. But big mihi to all of you tonight. We do know how busy you are, which is why we have the 7 o'clock session for the webinars, because you are out there with our whānau, serving them to the best of your abilities. And we just encourage you to keep going and embrace our cultural safety policy and the guidance that's there to support you. Is there anything you'd like to close off with, Dr. Peter, before I close us with karakia?
No, thank you. I think that was a key point you just made there. It's a journey. Tonight might be a first step. It might be a 10th step for some. That's good. We're all on this journey together. And as you said, many thanks to all the participants. Great that you're all here. Thank you so much.
Bye. Well, whānau, I will close us off with karakia and wish you all a pleasant evening. It's winter. Stay warm. Stay safe. Kia hau maru. Me noi tātou, e o mai te ti, e o mai te tā, he rea ki runga, he rea ki raro, whiria kia mau, whiria kia ita, hua kina te pō nau mai te ao, ka awatia, ti hei mauri ora. Mauri ora e te whānau.